Hi everybody, my name is Dr. Mumtaz. We'll just give everyone another couple of minutes before we start the live session. So I would like to welcome you all today to the live session we are having on the back to life, the new normal, whatever it is you would like to call it, in the current new world we are in. I can see a lot of people are still joining, so let's just give a couple of more minutes. I guess we will just get started now. Good evening, everybody. Welcome to today's session. My name is Dr. Mumtaz Meiran, and I'm a senior specialist working in the health promotion team within the Abu Dhabi Public Health Center. And thank you for joining us in today's session as we are going to try and talk through about the new normal now that we are in the second in a stage of the pandemic where things are slowly going back to normal, but then there is also a real importance about continuing to maintain whatever we have done so far. So we continue to keep up with the progress and the great achievements that we as a country have achieved in the UAE. And I think it's thanks to all your commitment and of course on the wise leadership and the decisions that have been taken quite early on that have helped us achieve the results that we are seeing so far. But it's even more important we continue with whatever we have done. So that's the reason today's session is there, and I would like to welcome you all. So before we go ahead, I would just like to give you a brief overview of what today's session is going to cover, or what I'm going to be speaking to you about. So a couple of things you would already be very well aware of. So we're going to start off by discussing a little bit about the COVID-19 and what are some of the symptoms of COVID-19. Talk a little bit about the facts of COVID-19, and then we are going to go and talk about what are the precautionary measures that we all should be following, adhering to at this point in time. And then after that, we are going to touch very briefly upon testing, having the Al Hosn app or the contact tracing, and then finishing it off with some frequently asked questions that we usually hear when we do these sessions, health education sessions with members of the public. So that's basically what today's session is going to be. And then if you have any questions as we go along, please feel free to put them on the screen, and then hopefully there will be time at the end for us to answer some of those questions. So without further ado, let's get started. So this what we are ideally trying to do is we are basically finding ourselves in a new world. I think, how do we navigate this world that we are finding ourselves in? I don't think something like this, probably many of us or many people in the world haven't experienced something like this, what we have experienced in the last 7 or 8 months. And then how do we navigate the new normal? What is it that we should be doing, and why is it that we should be doing what we are being asked to do? So that's how we are going to be doing this talk. I don't want to call it a presentation, this talk. So what is COVID-19? As you all know, this is a new disease which is caused by the novel coronavirus, which was identified in the Wuhan city in the Hubei province in China sometime end of December 2019. Now, the disease spread quite quickly all over, and then in March it was declared as a global, a global emergency, public health concern, and then it was soon after declared as a pandemic by the World Health Organization. So this is a disease. Now this is caused, as I said, by the novel coronavirus, and the actual name, the sort of the scientific name, if you want to call it, for this virus is called as the SARS-CoV-2. Now, are coronaviruses new? No, of course not. There are many strains of coronaviruses that are already in existence that are known to affect human beings, and then they range from very mild respiratory diseases like causing as a common cold, and then going on to causing quite deadly diseases, and like sort of causing pneumonia and going into respiratory failure and death. So that's the range. So there is not the coronavirus, we cannot say it is the coronavirus and it is causing one particular type of disease. It causes a range. It's a spectrum from a mild infection to causing like really severe ones, and then causing death ultimately, unfortunately. So what are some of the symptoms of coronavirus or COVID-19? Now, if you notice before, the symptoms of COVID-19, as we have known more about the disease, as the pandemic has emerged, as we have had new evidence and new research that have come in, if you notice, the symptoms of COVID-19 have quite expanded as well. Initially, we used to say if someone had a high temperature, that is having fever, if they started to develop a dry cough, a new dry cough, and then if they have any sort of breathing difficulty or, shortness of breath, that's the symptom. But obviously now, as the disease has emerged and as the condition, as more and more people have become infected with it, we know that the symptoms are quite far ranging. So you can have someone can have absolutely no symptoms, and then when they get themselves tested, they can end up having, they will know that they have COVID-19. Or someone can have a combination of symptoms. They can just have one, or they can have two, or they can have very many. So it's a range. So the most common or the usual symptoms that we see is basically, as I said, anyone having a high body temperature, there is a dry cough, breathing difficulty, people complaining of headaches, sore throat, any sort of upper respiratory tract infection symptoms, and then, if people are developing breathing difficulty. And strangely, one of the common things that a lot of people are reporting are also if they have a loss of sense of smell and taste. That has also been reported as one of the symptoms of COVID-19. Now, what sort of has shifted in the focus of COVID-19 is when the disease was first known, or when it first emerged, the understanding was that it was a respiratory disease, and then, that's what it is. But the more we know about the disease, it almost seems like it sort of affects many systems in the body, but most often it affects the respiratory system, but it also has other manifestations in other systems or organs in the body. And so far as we know, and around 20 million people, almost, or 19 million people have been affected worldwide, and around more than 700,000 people globally have died from the COVID-19, sadly. And within the UAE, our most recent figures are around 63,000 people have been infected, and many people have recovered. That's good news. But then we have also lost around 350 odd people who have died because of COVID-19. Now, how does COVID-19 get transmitted? I believe it's very important that everyone understands how COVID-19 gets transmitted, because if people understand that, then what happens is it makes it easier to understand the precautionary measures. Then the precautionary measures all start to make a lot of sense to people, why they are being asked to do what they are being asked to do. So there are three main methods in which the COVID-19 gets transmitted, and most of it is basically through contaminated respiratory droplets. So now, what do I mean by that? What I mean is when we speak loudly, or when we cough, or when we sneeze, we expel these small tiny particles from our mouths and from our noses. Now, these are called as respiratory droplets. Now, if somebody is infected with COVID-19, then what happens is, infected with coronavirus, SARS-CoV-2, what happens is then these droplets are infected. Now they are infected and the droplets are infected. So now with that in mind, let's look at the three most common ways it gets transmitted. So the first one is obviously if you're going to be in close contact with somebody and then they are going to cough, they are going to sneeze, or then they are going to speak out really loudly, they are going to shout, they are going to be expelling these droplets. And if you are in close contact with them, hence the reason, the social distancing, we talk about the 2 meter distance. So if you are in close contact with them within this 2 meters, you can inhale these droplets. So that means thereby you get infected from this other person. So that's the first one. And then the second way is when someone is coughing or sneezing and these droplets, what happen is when they get expelled, they stay for some time in the air. They sort of stay there. So if someone is going to breathe in that, then they get infected. And the third important way, or the third way in which transmission occurs, is because when these droplets, when someone coughs or sneezes, because of gravity, they sort of fall down. Now when these droplets fall down, they can land on any sort of surfaces. So they can land on a chair, they can land on a kitchen countertop, they can land on a desk, they can land anywhere. So if you go and touch the surface, now that basically means that droplet, the contaminated droplet, has come onto your hands with the infected virus. And then if you're going to touch your face, if you're going to touch your nose, your mouth, you get infected because the virus is there and you're sort of touching and you get infected. Now these are the modes of transmission. Now that you know the modes of transmission, it should be quite simple, sort of to understand the precautionary measures. So what are the precautionary measures? A lot of the precautionary measures you're already aware of. I'm sure everybody that's attending the session today clearly knows what are some of the measures that we are talking about. But then, I would like to talk about the precautionary measures in terms of, what are the general measures which we all should be focusing on. So all of which should be focusing on. The first thing would be in terms of hand hygiene. So that is washing your hands frequently with soap and water for at least 20 seconds. Now that is like a given. That is something we all should be doing, washing as frequently as we can with soap and water. Now, if we do not have access to soap and water because you're outside, your hands are not visibly dirty, you don't have access to it, then you can use an alcohol-based hand sanitizer. Now, when you use an alcohol-based hand sanitizer, just please make sure you're going to look at the product label, because every product has a label. And then if you see the back, you would see that, it has to contain at least 60% alcohol. You want that level of alcohol to make sure that it is going to actually make a difference. Now, kill the virus basically, or anything else. So when you use the alcohol-based hand sanitizer, again, you would only use, because someone has asked why only alcohol hand sanitizer, because the 60% alcohol that is there is what is needed to sort of kill any sort of microorganism or the or the bacteria or the virus that is in your hands. That's why we say alcohol-based hand sanitizer. So when you use the alcohol-based hand sanitizer, what you're going to do is, again, you're going to make sure it's going to cover all the surfaces of your hands, similar to what you would do when you're using soap and water to wash your hands. Because what people tend to do is, we always see people just squirt a little bit of sanitizer, they do this, and then they think their job is done. No, you need to make sure you're covering the, both the surfaces of your hands. You're covering the in between your finger, the digits, the webs. You make sure you're going to be covering or cleaning, the tips of your fingers, your nails, up to your wrist, and then you wash your hands the same way you use an alcohol-based hand sanitizer. Now, this is the hand hygiene. Now remember, now you know why, we spoke about the methods of transmission. So this is to avoid the method of transmission about getting it from a contaminated surface. Now the second thing what we are going to talk about is respiratory etiquette. Now when we speak about respiratory etiquette, I know everyone, even without COVID-19, we all should be doing that, and I'm sure a lot of us do, but it's always good to sort of revisit those things, those tips that we always think about. So the first thing in terms of respiratory etiquette is when you are going to cough or sneeze, make sure you have a tissue and you're going to cover your nose and your mouth when you are coughing or sneezing. Now we do appreciate that, coughs and sneezes, you might not always have access to a tissue, and coughs and sneezes are not going to be waiting until you can get hold of a tissue. So in the case that you do not have a tissue to hand, then make sure you're going to be coughing or sneezing into your flexed elbow. So this will make sure that that area is not a frequently touched area. So that way you're going to make sure you're reducing your contamination. Now that is in terms of respiratory etiquette. Now what is the third thing that we all should be doing? Yes, we all should be wearing a face mask anytime we step out of the house, or when we are going to go and where we are going to be seeing other people. The whole idea about wearing the face mask is because the face mask is going to act as a physical barrier, so it is going to protect you. It's going to protect you. So if there's anyone else that's infected, if they are coughing, they are sneezing, whatever that might be, or if there's anything, any sort of thing that is lingering in the air, then you're not breathing in, or it is not going in through your mouth, or it's not going, you're not breathing in because you've got a face mask. That is going to act as a physical barrier and protect you from getting infected. And the other thing with the face mask is, if you're the one who is sick, then obviously that also helps you from passing on the infection to other people. So it sort of acts in both ways. So these are the things that you should be doing. And without, mistaking anything, the other thing that we all should be talking about is in terms of social distancing, which is maintaining the distance of 2 meters from each other, so that, you're sort of maintaining the distance from people. Because so far what they have found, or what we know so far, is when these respiratory droplets, they can travel a lot of distance under certain conditions, but in normal conditions, in regular everyday life conditions, that they really cannot travel beyond the 2 meters, and because of gravity and they're quite heavy droplets, they will fall down to the ground. Hence the reason you maintain the 2 meter distance from other people. Now, these are some of the general measures. And finally, the most important is, however slightly unwell you may be, please stay at home, because a lot of the times in the current situation, it's better to stay at home. You might think, oh, what I have is not COVID-19. I have a very mild sniffle. I have a very mild temperature. I'm perfectly fine. I'm sure what I have is not COVID-19. It's probably not COVID-19, but I think when we are in the midst of a pandemic, as what we are now, it's way better to be more cautious and to take more precautionary measures. So even if you're very mildly unwell, just make sure you are staying at home and not going out. Now that's one of the general precautionary measures. Now, when I talk about the mask and when I talk about the tissues, the conversation is not going to be complete until we discuss how we are going to be disposing of the tissues and the masks. Now, when you use a tissue, just make sure you're going to be disposing it off responsibly in a closed bin. The same way, when you're going to be wearing a face mask, and then when you remove your face mask, please make sure you're going to be disposing it off responsibly in a closed bin. We do see and we do hear of many instances where people have just discarded their tissues, or they use tissues or their masks somewhere littering on the streets, and that is really not a right approach or a right practice, because that means someone else who has to clean it, someone else who is has to pick it up, someone else who is walking past it, they can get infected from this. So just be mindful when you're using the tissues, or when you're using a mask, you're also making sure you are disposing it off responsibly. And also the other thing in terms of talking about the masks is that masks tend to give people a false sense of security. A lot of people think that I'm wearing a mask, that means I'm fully protected, I don't need to worry or think about anything else. And unfortunately, that is not the case. Even if you are wearing a mask, what you should be doing is you should be making sure they are only effective, the masks, they are only effective when when it is combined with hand hygiene, and you're practicing all the other things that we discussed. So before you're going to pick up your mask and put it on, you will make sure you have washed your hands thoroughly, and then you take the mask and then you put on your mask. Now, when you do put on your mask, just make sure that it covers your nose and it covers your mouth, and then you have worn it correctly. A lot of times what happens is we see people wearing the mask and then it is somewhere here or it is somewhere here. I see many people wearing the mask and the mask is somewhere here and their nose is completely exposed. And I think that's sort of pointless, because when you wear a mask, you're not wearing it for somebody else. You're wearing it for your protection and for protecting other people. So just make sure you're wearing it completely covering your nose and your mouth. And when you are going to dispose it off, you have to use, take the side, there are usually the side stirrups in the mask. Just take it from that and then you dispose it off in a closed bin. And then, of course, you have to wash your hands soon after. When you are removing your mask, please do not touch the front surface, the surface of the mask with your hands. The reason is because, like I said before, it acts as a physical barrier. So when you're out and about, walking, talking to people, going about your business, what happens is everything that's there in the air, possibly including the coronavirus or any other bacteria, sort of comes and it lays, it sort of rests or on the barrier. So when you are going to touch the mask, now you have got it in your hands. So be mindful of not using that, using the side stirrups and taking it and disposing it off. Now, these are some of the precautionary measures that we all should be doing, we all should be following, at any given point in time. Now, when we talk about the masks, a lot of people ask us, what is the safest mask to use? What should we use? So there are different kinds of masks, ranging from the N95 respirators, which are usually used by healthcare providers and professionals when they are taking care of patients in a hospital setup. Most of us who are not working in a hospital setup, who are working in offices, who are working in other agencies, you do not need an N95 mask. You can either use a surgical disposable mask, which is probably a better version, but you can use a paper mask, you can use a cloth mask, whatever suits you. The only thing to remember when you're using a mask is the whole thing we discussed before, which is washing your hands, making sure you're putting it on properly, covering your nose, your mouth, and then disposing it off. So, and also use how the mask is meant to be used. So if it is a disposable surgical mask, then you wouldn't reuse the mask. And if it is a cloth mask that you're using, just make sure you're going to wash it, launder it properly, and then you're going to be disposing that, right? So that's the thing about the mask. So then when we talk about the precautionary measures, so these are your general guidelines in terms of the practices, what we should be doing, right? Now when we come, there are certain other things that we need to think about when we, in the current situation that we are in. So the first thing is, how do you greet people? Now we are in this stage of the pandemic where we are no longer in lockdown. Everything is open. We can go out. We can meet people. If you're going out to work or you're going out to the mall. And then what happens is you run into people that you haven't seen in a long time. You're sort of seeing your colleagues after quite a few weeks or months. Then what do? So it's very important to think that now we are in the new normal. So that's the reason why we are even doing this session because it is like, how do we navigate this world that we find ourselves in? The practices, the cultures, the traditions that we all sort of took for granted, and that forms an important part of who we are and our lives. There's been a change in that. So then how do we navigate this new normal? If I'm going to do this, am I going to come across as rude to my colleague? Is someone going to think I'm not being polite? These are sort of things that go through our minds all the time. But now is not the time for any one of us to be thinking along those lines. So when we think about greeting safely, when we meet somebody that we haven't seen in a while, or whoever that might be, someone we see every day, the key things to remember is you need to make sure that, whichever way you choose to greet a person, there has to be absolutely no physical contact with that person. So that means you're not going to be shaking hands. Still, shaking hands is not allowed. You're not going to be hugging or kissing somebody. If that's your way of greeting somebody, you're not going to be doing that. You're not going to be doing any nose-to-nose greeting. So anything that sort of is a physical contact way of greeting is a no-no. So instead, what can you do? So I think it's always nice to talk about what you can do as opposed to what you can't do. So in terms of what can you do, how can you greet somebody? You can possibly wave at them. And there are lots of very ingenious ideas and videos I'm sure you all have seen in a lot of social media telling us about different ways of greeting people without making any physical contact. And the other thing to remember is obviously you will be maintaining a distance of 2 meters from them, and you will not be meeting people in any sort of, you will be avoiding any large crowds or crowded areas, to hang out in. So that's the first thing about greeting safely. Now, in terms of our lifestyle and what is it that we are doing with our everyday things, what are some of the precautionary things we should be doing? So you would be, as I already said, you would not be going to, crowded places or assemblies or any sort of gatherings. That's like a no-no still, because remember we spoke about the methods of transmission. So in a crowded place, you're sort of putting yourself at an increased risk of getting infected or infecting other people. So, avoiding crowded places, and absolutely no gatherings, no family gatherings. And we do really appreciate how hard it has been for very many people this year in terms of both the Eids that we have had, where we have told, no family gatherings. I think these are all the things which people have taken for granted. This is a way of our living, our lives. And suddenly we are finding ourselves not being able to do the things that we used to do before. So we do appreciate it is really difficult and it is a challenge. But believe me, it's a challenge which we are all facing, the whole world is facing, and the quicker and the better we are able to adhere to these things, probably the better we will be able to overcome the virus quicker, and inshallah we will go back to how things were before. But until that time comes, it's very, very important we continue to follow these precautionary measures. So absolutely no family gatherings, and then any gathering cannot be more than 5 people. Now again, the reason is a lot of people we see, I know, despite what the guidance says, despite all the education sessions that we are doing, talking from Abu Dhabi Public Health Center, we have an extensive, our comms team is absolutely brilliant. They have a lot of social media posts, they are doing a lot of work, our team, in raising awareness amongst people. Still, people seem to tend to do certain things which they are not supposed to do. So the thing to remember is no public gathering, and especially if you're going to be in an indoor space, and if you're going to be meeting people, and if it is an indoor space and there is not a lot of ventilation, then the evidence that it's like inside a home setup. So the evidence that we have, whatever we know so far, there is an increased risk of transmission. So you need to be exceptionally careful and try and really not have any sort of gatherings when you are no sort of public gatherings. Then what about cars and private and public transport? This is another important thing that we keep hearing from people. So it's like I think if you're able to, and you have access to a private car, your own car, then that would be the best way of transport. Try and avoid any public transport. But we do appreciate that not everyone has access to a private car. So when you're going to be using the taxi or when you're going to be using the public transport, just make sure you are following all the instructions that's there, because everywhere there are instructions on what you should be doing. You will have people guiding you. If you do not have anyone guiding you, then you do know the things that you should be doing, which is making sure you've got your mask on, maintaining the distance from other people, and then as soon as, if you're going to be, trying to avoid touching other things, the frequently touched surfaces. And then if you are going to be touching things, then just make sure you've got an alcohol based hand sanitizer with which you can sanitize, disinfect your hands. And then when you step out, go and wash your hands. And the same thing is applicable if you do go to work. If you do use a sponsored or your organization is going to provide you with the transport to work, then again, you would be, following all the instructions that are given to you. And then we also hear a lot of things about people asking, when they get delivery, because with, many people having been stayed at home and probably continuing to do things online, we do hear a lot of people asking questions, what should they do when they get delivery, when they get maintenance people, when they have maids over, what are some of the things that they should be doing? I think it's quite important to remember when you do get any sort of delivery to your doorstep, by all, try and avoid contact with the delivery guy. So what you can do is you can ask the delivery guy, they can deliver it at your doorstep. You have already done the payment over the phone or by an electronic method. That means you don't really need to see the delivery guy when they're coming to drop off your stuff. They can either leave it at the at your building, inside, wherever, whatever options you have available at your setting. Now, assuming you do have to meet the delivery guy, you don't have any other option, then what can you do? The same thing. You can maintain a distance of 2 meters from them. You can make sure you're collecting your parcel. And then as soon as you go inside and you leave it, then you go and wash your hands. Now, if you really sort of think about the precautionary measures, you will think that there are literally a handful of things that we all should be doing, which is the washing hands, the respiratory etiquette, the wearing the mask, the maintaining the distance. It's the same things, regardless of the setting, regardless of where we are. These are the things that we should be doing, as part of our everyday lives. And sometimes when we keep saying it, we also think, we are sounding like I now think I'm sounding a little bit repetitive in what I'm telling you over and over again. But the reason why we keep saying this over and over again is that so that it sort of becomes like second nature to you. So you're not really thinking about it. It becomes a habit for you. This is something that you do as an everyday thing. It's just the new normal for you, the way that you live. So these are some of the precautionary measures, the general precautionary measures that we do, and whatever we are doing, we talk about. Now, a lot of people keep asking us about the fines and what is allowed and what is not allowed, and things like that. And every time I have this query or this question, I always think to myself that all these precautions and all these guidelines are in place so that it's to protect yourself. Do you see what I'm trying to say? All these guidelines are in place for you to protect yourself, and then also for, to stop the spread of the infection. So these are not in place for anybody else. And I think one of the most important things that people have to sort of remember is that these things will not last forever. Right? I think, at one point when we were beginning at some time in the pandemic, there was a strict lockdown, people couldn't go out. There were a lot of things that were happening. Now we are in this stage of the pandemic where, thanks to your commitment and compliance of the public, as well as the leadership, as well as the governmental agencies, quick thinking, strategic, their strategic ideas, their strategies, the things that they put in place, we have done exceptionally well in the UAE in terms of containing the virus. If I'm not mistaken, I believe we are one of the top 10 countries in the world in how we have handled this pandemic. And I I think that's a lot of kudos to you, to the government, to the organizations, to everybody in UAE. I think they all should be very proud. So, and if we have to continue with this progress that we have made, if it's like we have come so far, and then there is a little bit more of a challenge, and then if we overcome that, then there is a whole new thing that awaits us, which possibly is a new normal. And sometimes people come this far and then they don't have the resilience to continue with that. So what I would like to say, that it's like you've almost crossed a whole lot of the pandemic, so it's time for us to keep holding on to what we were doing. It's time for us to keep up with the spirit, to be more resilient, and to continue following all the precautionary measures. So we see, we do see light at the end of this dark tunnel, and we will eventually get there, but it's in everybody's hands. We all need to work together. So that's the thing. So again, now as people are going back to work, I would just like to touch very briefly on, what people should be doing when they are going back to work. Again, it's exactly the same things that we discussed before, precautionary measures. But the one thing that I would really like to tell you is, do stay home if you are unwell. And all the agencies and, entities, they are aware. I think they have been, there are guidelines for them. So they will be following the guidelines. And, just make sure you inform your supervisor, your manager, whoever you report to, that you're not well, and stay at home, and then only go back into work when you are feeling really well. And I do believe there are policies at workplaces that will help people do this. And also we've been training a lot of health and safety people who are responsible for health and safety in organizations on how they have to do things. So I think as long as you follow the guidance, you will be safe. And again, in terms of schools, I know there is a whole, I think schools are starting in September. Children are going to go back to school, hopefully. I think that's as of now. We don't know. But in terms of all the guidance, just make sure whatever it is that you're doing, you're following the guidance that is given to you, whether it's your school, whether it's your work, whether it's, in your everyday life by the governmental authorities. Because as long as you follow those, rest assured you will be safe, and you will also keep other people safe. And I do want to say one thing. I think this is that time probably in our lifetimes, probably in the world, where we are all finding ourselves that it's not just about me, it's not just about you. We have to all think collectively about what is good for everybody, what is good for the community. Now, this is a time when, things might not be too much for one person, but it can be for another person. So we have to think collectively, thinking about how do we beat this virus, how do we overcome this virus, as opposed to sort of thinking on a more individual level and thinking that I'm not at risk, or if I'm going to get it, it's not going to be a huge deal for me anyway. I think there has to be that slight shift in mindset as well, into thinking more about, into more of a collective thinking, into more of an understanding and an appreciation of how far we have come and how much we have to go, and all of us working together. I think that's one thing. Then I think those are some of, how do we navigate the new normal. But I also want to sort of very briefly touch upon in terms of symptoms, and if you think you've been in contact with somebody, what you should do. So in terms of, like I said before, we spoke about the symptoms. So if you do feel you have any respiratory symptom, if you're not sure of something, please immediately isolate yourself. It doesn't matter however mild your symptoms are, isolate yourself. And if you're in any doubt, please do contact your healthcare provider. Or if you think you have been in contact with a positive case of COVID-19, so a positive case is usually defined as if someone has spent around 15 minutes with someone in close contact. Most likely this will be people we are either working with, or we are studying with, or family members. So they sort of usually get defined as contacts. So if you do think you've been in contact with someone who who later on tested positive for COVID-19, then you've got two options. So one option is if you are well, and then if you don't have any symptoms, if you're feeling perfectly fine, but you're sure you've been in contact with someone who has COVID-19, please do stay at home, isolate yourself, behave as if you are infected. That's one of the best things you can do. Behave as if you're infected and monitor your symptoms. If you do start to get any one of the symptoms that we spoke about, contact your healthcare provider. Now, if you think I absolutely cannot wait, I think some people do that because I think we're either very anxious, and which is completely normal in this time. So if you're going to feel very anxious, if you're going to feel very upset, then do contact the Istijaba service, which is 800-1717. And what they can do is they can then sort of sit with you. They will go through a quick, on the phone, they will go through a quick brief or a screening questionnaire with you, and then they will organize, a test for you if applicable. So you can do that. However, if you have been a contact of someone who tested positive for COVID-19, and then you are either, of a certain age, or if, you're over the age of 60, or you have any one of the chronic conditions like diabetes, high blood pressure, heart disease, someone is undergoing cancer treatment, or you're immunocompromised in any way, or you have a lung disease, if you have any one of the long-term conditions, then please contact the Istijaba service. First is you isolate yourself. That would be your first thing. You act and you behave as if you're infected. That would be the second thing. And the third thing is you make contact with the Istijaba service, and what they can do is they will arrange a test for you. Right? So it's quite important for people to get tested, and this is what you do if you think you've been in contact with somebody. Now this brings a very important question to me, which I was going to answer later, but I think it sort of flows with the talk, so I will talk about it now. A lot of people ask us, who is at risk of COVID-19? Who is most at risk? Now the simple answer to that is we are all at risk of getting COVID-19, because this is a new strain of the virus. As we said before, it has made the jump from the animal species to human beings, and it's brand new. So we are all at risk from it. But so far, whatever evidence we have, and so far whatever we know from cases around the world, in many people, like in majority of the people, like approximately 80% of the people, it is quite a mild to moderate disease. That means they don't, they get better. They just sort of take something, they sort of treat their symptoms, they rest well at home, and then they get better. But I think for a certain proportion of the population, a small proportion of the population, it does become a severe disease. And then, like we said before, a number of people sadly and unfortunately die from COVID-19. Now, when we look at it, again, it is a spectrum. So when we look at who are these people who are at risk of getting a severe disease, like who are these people, if we see data so far, what we have suggests that most of the people who get, on the severe end of the disease spectrum, they are usually older citizens, people, older resident citizens, people, individuals, whatever you want to call, older individuals, 60 and above, and also people who have long-term conditions, like what we discussed before. So it is even more important that, if someone is over the age of 60, or if they have any long-term conditions, they really adhere to these precautionary measures, and they do whatever it is that they need to be doing. And even if you live with someone who is older, if in your family, if you are living with a parent, a grandparent, anyone that falls into this age range, or you live with someone who has long-term conditions, you do need to be exceptionally even more careful than other people. But that doesn't mean that others don't have to be careful. We all have to be exceptionally careful. But I'm just saying, if someone falls into the high risk category, then they need to be even more careful. I think that's what I was talking about. And also, everyone always asks us about the 14-day isolation, the 14-day quarantine. What is this 14 days? So in terms of the isolation and the quarantine, so quarantine is basically, I know these are words, that have formed a part of our everyday vocabulary. We keep talking about it. Things, we never spoke about in 2019. They're very trendy in 2020. We talk about social distancing. We talk about quarantine. We talk about isolation. So quarantine basically means someone has been exposed to the disease, but they are not sick yet. Right? That means they don't have the symptoms as yet. So they may be sick, but they don't have the symptoms as yet, and they have been exposed to the disease. So the idea of quarantine is that they are going to stay, in their place of quarantine for 14 days, and then they are not going to go to work, go to any public place. They are not going to go do their groceries. They're basically going to stay put at home or their quarantine site unless and until they're going out to seek medical help. Now, this is the idea of quarantine, and the whole idea is they're going to be staying at home to see if they develop any symptoms. And if they do develop any symptoms in this time, then they contact the healthcare provider and things go on from there. The thing with isolation is when a person is going to go into isolation, that already means that they are ill. Right? So that's the difference. In quarantine, the person is not ill. When they are in isolation, the person is ill. But the methods of what they do in terms of separating and restricting the movement is the same. Now, in terms of quarantine, we do know when people are coming, traveling from abroad, when people are going, or if there have been a possible contact, then they have to stay at home for 14 days in quarantine. And if you are given, I really plead with people on this, if you have been given instructions by any authority to stay at home for 14 days in quarantine, please do so. This is not the time for people to be figuring out or using their logical thinking, oh, I'm not that ill, I don't have that many symptoms, I don't think I'm unwell, I can go out, I can do this. This is not the time to be doing that. Please make sure you follow the instructions that have been given to you, and you then go on from there. And the 14-day quarantine is to sort of factor in the incubation period, because incubation period is basically, we talk about in terms of any infectious disease. So this is basically the time period or the interval between when someone gets infected and then they go on to develop the disease. Usually there is the time period. So someone can get infected today and they may not have symptoms for the next couple of days, or they may not have symptoms for the next few days. So they're already infected, and there is a possibility that they can transmit that infection to someone else, but then they don't know that they have got the infection. That means, they can, so that's the incubation period. So for the COVID-19, the incubation period can be up to 14 days. Hence the reason it can take up to 14 days for the symptoms to come. Hence the reason for the 14-day quarantine. Now, someone has asked a question: do people who took the vaccine able to take out the face mask? Now, I believe you're talking about the people who have volunteered for the trial, the phase 3 clinical trial that we are all very proud of, that is happening in the UAE at the moment. And I would like to say, no, you still have to continue to follow all the precautionary measures, because the people have, the volunteers that have been given the vaccine now, they are in a trial phase, and the idea is to see if their body produces the immunity that is required and whether it is a safe and effective vaccine. Being a volunteer in the trial does not prevent you or protect you from taking part in the other precautionary measures. You should still continue to do that. Thank you. And finally, I would like to finish off by talking about two key things. The first thing is information. So we please urge you to get your information from trusted governmental sources, because these are going to be your reliable information sources. We believe that even the WHO has called this as an infodemic, because apparently the rumors and the misinformation about COVID-19 is spreading faster than the virus itself. So please be mindful when you receive a social media message that you're able to do a quick fact check. Just check that the information you have received is scientifically proven, it is a good, it is from the right source before you forward it to somebody else. I think there was even recently they published something in the American Journal of Tropical Medicine, I believe this was like a couple of days ago, that there have been so many people that have been hospitalized because of believing these rumors and doing certain things to themselves, thinking that they were either protecting themselves from getting COVID-19 or treating themselves for COVID-19. So you can actually do harm rather than good. So please be mindful and make sure you get your information from trusted information sources. Within the UAE, definitely you can get your information from the the Department of Health website, or contact 800-1717 if you have any queries, any concerns. If you think you have any symptoms of COVID-19, that's the first thing. You can also get your information from the Ministry of Health and Prevention, which would be 800-1111. And finally, if someone wants to get information in Dubai, you can get it from the Dubai Health Authority in 800-342. So please be mindful of that. Get your information from there. And then finally, when we find ourselves in a situation such as this, for which there is no safe and effective vaccine available as of now, we really hope and pray that the clinical trials that we are having are successful and we will be able to deliver and produce a safe and effective vaccine very soon. But in the absence of having a safe and effective vaccine, and when we do not have a specific treatment, there is, it depends upon the body's immune system to fight off the disease or the infection. So when we talk about the body's immune system, it is very important to have a strong and a healthy immune system. We do know that there have been a lot of talks about, magic pills and immunity boosters that can make people feel instantly, give a boost to the immunity. There are a lot of these claims, and there are a lot of people that, that believe those. But scientifically, what we know is the only way that you can have a strong and healthy immune system is by following a healthy lifestyle. I know it's not very it's not what's that to say, it's not like a magic thing that I'm saying, but the thing to remember is it's only having a healthy lifestyle, by consistently having and following a healthy lifestyle is when you're going to have a strong and a healthy immune system. And having a strong and healthy immune system is quite important to fight off infections and diseases. So when we talk about a healthy lifestyle, what are some of the things we are talking about? We talk about things such as, first is smoking. I think if you smoke, it's a very good time to give up smoking. So the first thing is not smoking. Then the second thing is having a healthy, well-balanced diet. So make sure your diet is quite well-balanced. You're having a range of food, high in fruits and vegetables and fiber and low in saturated fats. I think having a healthy, varied diet is very important. Then the next important thing is obviously physical activity. Being physically active is not, it sort of helps in many ways. It's quite important to be physically active because it's good for your your lung function, your cardiorespiratory fitness, but then your muscles. But then it also is very important to help maintain a healthy body weight, which is one of the components of having a healthy lifestyle. And the other thing also, physical activity is very good for your mental health. Now, when we are all experiencing what we have experienced because of the pandemic, the impact of the pandemic itself, the anxiety about the disease, the worry whether, someone we will get it or someone we know will get it, or having the impacts from being put down because of the lockdown or because of not having access to our usual coping mechanisms and strategies. All of this play a really important role, in playing havoc with our mental health. So, physical activity is one of the best things that people can do for their mental health and well-being. So, think about, engaging yourself in any sort of physical activity. And we already spoke about maintaining a healthy weight. And I would also like to sort of talk about sleep. Sleep somehow seems to be one of those really underrated things which people don't really think about when they're thinking about a healthy lifestyle. But getting the recommended amount of sleep is also very important for you to be able to function better, for your cognitive functions like thinking, memory, language. You talk about it, having a good quality, good restful sleep is quite important. And finally, take care of your mental health and well-being, because you sort of need to look at it more holistically. It is the physical and the mental. So in terms of, we cannot avoid stress. Stress is a part of life, but trying to come up with ways of how we can manage our stress levels better, trying to figure out what it is that we can do so that we are more relaxed and restful. Things like practicing mindfulness, yoga. There are very many things, whatever relaxes you, and trying to come up with coping mechanisms that work for you in terms of managing your everyday stresses. All these things are part of a healthy lifestyle, and they will all play a very important role in helping you have a strong and healthy immune system that, within the context of the COVID-19 that we are talking about. But having a healthy lifestyle is also very important for various other diseases and conditions, as everybody knows. And with that, I would like to thank you all for joining us in today's session on the Instagram Live for how do we navigate the new world. I hope in the time that we have had together, I have been able to tell you a little bit about the precautionary measures. Why is it very important that we still continue to practice the precautionary measures, and why it is also important to remember that this is not going to last forever. We are talking about a certain period of time. So let's keep the momentum going. Let's keep following the precautionary measures. Let's wear that face mask. Let's wash our hands. Let's do all those things. Let's maintain a distance of 2 meters from other people. And when we are out and about, let's follow the guidelines of the authorities that are, whatever guidelines the authorities are telling us. Let's keep the momentum going. Let's keep going until we reach a stage when we have finally, beaten this virus. Thank you very much. I do see a couple of questions. I will answer those. So if you have any questions, please feel free to type them in. Somebody has asked for negative results. Why quarantine? That's a really good question. I think one of the things to remember is there is not one screening test, or there is not one test that is 100% accurate. So when we are talking about the PCR test, there are a couple of reasons why sometimes the test results can come as negative, but the person, it could be a false negative. That means the person is actually infected, but the test has come negative. Maybe there is not enough viral load, or maybe the way that the test was administered, there was not enough on the swab, or maybe there was there are many reasons why it could be a false negative. And when we are in the midst of a pandemic as what we are now, we really cannot afford to take any absolutely no risk. Hence the reason, even if the test is negative, someone has to be in quarantine for 14 days. So assuming in this 14 days you do develop any sort of symptom or anything, you contact your healthcare provider, and then they will advise you what to do. So hence the reason you have to be in quarantine even if the test result is negative. I hope that answered your question. Thank you very much. And if those are the number of questions that we have had, I would like to thank you all for your time and for joining us today on the Instagram Live, and we hope to see you all again soon some other time. Thank you very much, and we will just end this now. Thank you. Bye-bye. And before I end, I would like to give a big shout out to some of the people whose names I saw popping up on the screen. They are here to support me. You know who you are. So thank you very much for being here this afternoon and for all your support. Thank you.